The Big Whack presents Buffalo on the Rise, sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of The Big Whack presents Buffalo on the Rise. Do you suffer from chronic pain and everything you've tried offers little or no relief? Meet Doctor John Zilliox and hear how his advanced treatments can help. Want to remodel your bathroom but don't want to spend a lot of time and money doing so? Bathfitter has the solution. Plus, making your smile count. Dr. Kaplansky is back to tell us all about his Teeth Now process. All on this edition of The Big Whack presents Buffalo on the Rise.
Hi, I'm Joe Chili. Mornings from 7 to 9 on Buffalo's oldie station, The Big Whack. Joining us on The Big Whack's Buffalo on the Rise today is Dr. John Zilliox from Positive Health and Wellness Chiropractic. Doctor, nice to see you.
Joe, nice to be here.
You know, it's always nice to see a doctor when it doesn't cost me any money.
That's correct.
I always enjoy that. How long you've been in practice and what kind of practice do you do?
Joe, I've been in practice for almost 40 years. In 1985, I started in practice. My practice has ventured outside of chiropractic. And I'm also a licensed New York State nutritionist, dietitian, so we implement a lot of nutrition in the practice. But we've gone beyond chiropractic in terms of the kind of conditions we see in the office. So we use a lot of different types of therapies to treat different types of conditions.
You know, one of the things that I think that you talked about, and you may have even done a book on this, is about knee pain, something that's very chronic with individuals. And you have a book, No More Knee Pain. It's actually the name of the book, right?
That's correct.
Tell us a little bit about this, and is it an alternative to having knee surgery?
Great question, Joe. I just had a seminar today. We had 27 people at our seminar in the office, and a lot of these people who are facing knee replacements are looking for an alternative. Now, I don't discourage people from having a knee replacement, but however, there are alternatives to improving their functional quality of life. So I integrate a lot of different therapies which are on my website, and I show the people in the seminar the therapies we use and how it's effective, and plus a lot of testimonials. People who were told they're bone on bone, that they needed knee surgery, have been able to escape that.
You know, knee surgery, back surgery is another thing that we hear, and I have to tell you, you know, I've talked to people that have had back problems, and 9 times out of 10, they say the last thing you want to have is surgery. You know, try anything else before that. And you've also done a book with regard to that, right?
That's right, Joe. My book is The Non-Surgical Solution to Back Pain. And what it revolves around is non-surgical spinal decompression. Now, I've been doing non-surgical spinal decompression since 2007, and it's an amazing therapy, clinically documented to 87 to 92% success rate in terms of treating herniated disc, bulging disc, protrusions, stenosis, and things like that. So really, people who have been told they need surgery, generally going through non-surgical spinal decompression can avoid that.
You know, one of the things that, and this is a misnomer, I'm sure, one of the things that people think about, and I've thought about as well, when you go to a chiropractor's office, you think of cracking and, you know, things like this. And you don't use those regular type of therapies. You have different methods that you use, right?
I do, Joe. I mean, I used to use manual manipulation quite a bit. I still use a little bit of it in my practice, but I use computerized adjusting. I have an instrument that utilizes adjustments instead of using my hands, which are extremely effective in terms of patient comfort and results.
Tell us about, and we talked about this a little before we went on, I'm interested in it, Calmar therapy, right? And I mistakenly said, being Italian, calamari therapy, and you correctly corrected me right away. Tell us about it's like is it a nerve scrambler?
So what Calmar therapy does, it's a therapy that came from Italy, and it was developed over there. And what it does, it's basically for people that can't get relief from any type of pain, whether they're on opioids, from failed back surgery, knee surgery, shoulder surgery. It doesn't work with arthritis. It only works with nerve pain. And what it does, it scrambles the nerves so the brain is not receiving pain signals, but no pain signals. And the reason it does this is because it scrambles the nerve signal to the brain. When we see patients like 5 days in a row, take a break on the weekend, another 5 days. And each treatment decreases the amount of discomfort. And this no pain can actually last from months to over a year. It's not a cure-all, but what it does, it gives patients a quality of life that they're not receiving otherwise.
So should patients try an alternative therapy before this, or is this something that they can, try this nerve scrambler rather than doing like the medications or the things like that?
Oh, absolutely. We've had great results in treating neuropathy with the Calamare, and especially patients who have had chemo-induced neuropathy from nerve damage. And so it's always best to try non-invasive stuff first before you go the invasive route, and relying on drugs and medications.
So does it wear off after time?
Well, it's been shown to last over a year. And sometimes, patients come in, they just come in for like a redo. Maybe they've had it and they've had the treatment, and maybe 6 months later, I'm still feeling a little twinge here and there, so we just do a redo treatment for them.
Yeah, how long does it take to do something like this?
The treatments last an hour. Treatments last an hour.
Is it over a long period of time?
No, like I said, we treat patients 5 days in a row, and they lay comfortable on a table. They really don't feel, they feel a little tingling in the joint or wherever we're treating, and then when they're done with the treatment, they'll notice a decrease in their pain. Now, it may last maybe an hour or 2 hours, but the next time they have a treatment, maybe it lasts a day, and then all of a sudden, every treatment builds on the previous one until they find that we take their pain from, say, on a 0 to 10, 10 being the worst, down to a 0 or 1.
Wow. One of the other things that you focus on is nutrition. Tell us a little bit about this.
Yes, nutrition is a very big part of my practice, and basically with my nutritional programs, I know people are looking to lose weight, but the one thing you really have to realize is you need to treat the gut. A lot of people have what's called leaky gut syndrome, and what happens is that because of medications, lifestyle stress, and diet, what's happened is that they develop a lot of food sensitivities because their gut becomes porous, and they have abdominal complaints, joint complaints, and all this stuff. So my nutritional program is designed on healing the gut, and then it's much easier to lose the weight.
That's great, because I hate to go up and say, hi, I'm Joe Chili, I have leaky gut syndrome. Just doesn't go over well with people. Dr. John Zilliox, thank you very much. We appreciate it.
You're welcome, Joe.
For more information on connecting with Dr. John Zilliox at Positive Health and Wellness Chiropractic, you can visit the office at 1408 Sweet Home Road, Suite 3, Amherst, New York. You could call 716-689-3629 and online at these websites, meetdrz.com. That's meetdrz.com. or also buffalodisccenter.com. Sponsorship and promotional consideration for the preceding segment was provided by Positive Health and Wellness Chiropractic. I'm Joe Chili. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Rachel Berbeles, who's the Director of Marketing for Bathfitter. How you doing?
Good, how are you?
I'm doing very well. Look at that smile. It's a smile that attracts everybody. You make the show look so much better when you come out. Thanks, I really appreciate that. Now, I want to talk a little bit about Bathfitter in general. 40 years in the market. Businesses sometimes don't last 6, 7 years, 8 years, right? What do you attest that to, 40 years?
The people, for sure. It's the people that have worked here. I know myself, I've been here 12 years. Some people obviously have been here since the beginning. Even in Buffalo, we have employees that have been working here 20 plus years, but it's the people. We're like a family, and we've learned and grown together, and we do a great job.
See, it's okay for you to pat yourself on the back because, this is what this is all about. And I think the other thing is, I realize, at least I have heard, and you're probably going to be able to echo this, improvements to bathrooms and kitchens are the most when it comes to resale value of your home, right?
Yeah, it's great to update your bathroom in your home or your kitchen, just something beautiful that's long lasting. So something at Bathfitter, in the world of remodeling your home, I think something that's really important is picking a company that you can trust. So whether it's your kitchen or your bathroom, one of the things that we really work hard to be is a company that you can trust. So doing business with us, we take it personally. 40 years, we've done things really right. We've learned from some of the things that we've done, and we want to be around here for 40 more years, going forward. But I think when you are looking to remodel, whether it's your bathroom in your home, doing the research of a company, making sure that they're insured, that the reviews are good. What have the customers locally been saying about that company? I think there's just some research we're hoping that customers start to do before they do any kind of investments into their home for resale value or just to live there. And having a company that you can trust is important.
I think people too, when they think about it, when they use, like, say, for instance, contractors, and I don't want to give contractors a bad name or put shade on contractors, but sometimes you get them in and they have multiple jobs. And so, you might see somebody, on a Monday, and then you see him next Tuesday, and then you see him the week after or whatever. But you guys go usually start to finish, right?
Yes, so bath fitter is all we do. So the tub and shower area is all we do. And something great to mention is, so say you're having estimates, the sales guy comes in, and everyone hates being sold, I would think. So you have everybody selling the best thing out there. But then when the person that actually comes to the install, they're bath fitter employees. We don't hire or contract anyone out. The work's done in a day. So that person that arrives to your home to do the actual install, they work for us. We make and manufacture all of our products. We make and manufacture all of our machines that make our products, and everyone that you deal with is a bath fitter employee. So we are in control of the process from the day you meet us until forever, because you have a lifetime warranty.
When somebody comes in and they want to, maybe have a tub taken out, put a shower in, or whatever the case may be, are the days of showing them drawings over with? Do you use, iPads? What do you do now?
So we do a couple of things. What's cool, we do have an iPad that goes in and it does like a little 3D scan and measures your bathroom. But then we also have a tool it's called Design Your Own Bath. You can visit it online at designyourownbath.com. But customers make like a 3D rendering of their specific bathroom. Do they want a tub, a shower, grab bars, seats, glass doors, grab bars?
When do people ever get embarrassed? They're like, oh, here you can come in and look at my bathroom, but don't tell anybody. Don't look at my pink or green tub.
Yeah, you hear like the music when you're pulling back the shower curtain. Yeah, I mean, it is something that the beautiful shower curtain hides that. So it is maybe embarrassing, but not for us. It's something that we have been dealing with for 40 years, so don't be embarrassed by whatever's behind the curtain. We'll take care of it and make it beautiful.
Ignore the man behind the curtain.
Yeah.
No, what bothers me, and I'm in a townhouse, it's a little bit of an older townhouse, and just even water spots, water buildup, and then you're scrubbing away and scrubbing away and scrubbing away, and it takes forever to kind of get that done. But the newer tubs, showers, things like that, it doesn't affix. Is it more porous? I don't know.
Yeah, so it's ours is made from acrylic. It's a non-porous surface. It's I use Windex at home. Wipe it down. It looks shiny, brand new. In case you didn't know what Windex sounded like, it was like. So I wipe it down and it looks brand new. You're not worrying about water spots because it doesn't adhere. It's a non-porous surface, where some older units like fiberglass or the old porcelain, that shine has rubbed off and now it's absorbing all the colors and grime. We'll put the new stuff in. You don't got to worry about that.
How long does it take if somebody wants to have something done, between the time that, they figure it out, you give the individuals a price or whatever, and they get it done?
Yeah, so if you had someone in your home today giving an estimate, just as an example, let's call it 2 or 3 weeks. So you're gonna have us in there that day. We're gonna measure it, you're gonna design it. Those measurements go right off to the plant. We're actually gonna create it for you. It comes to us, and depending on our install times, 2 to 3 weeks. But upon arrival, the installer gets there in the morning, they're done before dinner time. So a day to install. So you're maybe like a 3-week time period.
I have family members that can't get out of a shower, in a day's time. So that's pretty darn good.
Well, we're doing same day estimates. So even if they called today, they could potentially have a salesperson out by later today.
Well, that's pretty wild. All right. So what is the first step in the individual, what they want to do? We have a minute left. What do you recommend a viewer do?
Sure. Give us a call or visit us online at bathfitterbuffalo.com. They could even go to designyourownbath.com. do a 3D rendering of their own bathroom, but give us a call, fill out an inquiry online, message us off our website. They could stop by our showroom, but honestly, the easiest way, let us come to you.
All right, very good. For more information and answers to your questions, contact Bathfitter by calling 716-242-8995 or go to bathfitterbuffalo.com. Sponsorship and promotional consideration for the preceding segment was provided by the following. I'm Joe Chili. You can listen to me mornings on the Big Weck. Joining us today on the Big Weck's Buffalo on the Rise is Dr. Kaplansky, and I want to welcome you to the show today. I'm impressed by some of the things I see about you. You know, we do background, obviously, before we do a program like this. So I wanted to look up some things about you. First off, you started in business with a friend of mine in Niagara Falls, which was a while ago, but all of your certifications and things like this, you'll have to explain some of these things to me, because if I look up dentists in general, I see a couple of things. Graduated from here, did work here, whatever, but you're board certified in implant dentistry, diplomat of the American Board of Oral Implantology, fellow at the American Academy of Implant Dentistry, fellow International Congress of Oral Implantologists, fellow Academy of Dentistry, certified Zaga Center, which is kind of like a mystery to me. We'll have to ask you about that. But what do all these things mean? To me, this means that all dentists are not the same, right? I mean, but when you start looking at all these things, how long did it take to get these? And was it something that you planned originally, or did you say, these are the things I'm going to go for as far as certifications?
Well, first of all, I'd like to thank you for inviting me
Sure.
to the program. It's my pleasure to be here with you. It's a lifelong journey, really. This obviously took years to accomplish. And unfortunately, that's what we see often now in practice, is many younger dentists just fresh out of residency are doing these procedures, and they probably don't have enough experience yet to perform them.
When you start talking about things, and you start talking about implants, because it's something specifically that you do, is there something that they teach you in dental school with regard to implants? You know, something that all dentists do. And how did you move past that to come up with your own teeth now method?
Absolutely. So in dental school, you get some really basic rudimentary kind of education on all aspects of dentistry, on all the different procedures. So they can't really focus on anything too in-depth. And then after you graduate, that's when you expand your knowledge, then you kind of go more into the areas of your interest. So my area of interest was dental implants, and I really wanted to get much deeper knowledge in that area. And that's how it all happened.
Dental implants, and I have a very basic knowledge of these things, so I'm going to ask you, but you know, you start thinking about things like bone grafts and the prep work that goes into this, and it sounds very invasive to me. And as just a normal individual, I like to avoid pain.
Absolutely, yeah. Well, we all do.
So I mean, you probably look the same way. You probably looked at this and said, there's got to be a better way to do this procedure.
True. So traditionally, dental implants aren't new. So they've been placed routinely for probably about 30 years now, with a lot of data, a lot of research, and it's backed up by science. Now, traditionally, the thinking in dentistry was that you have to prep the site first. So if the site or the bone in the area is deficient, you have to build it up. And how do you build it? By grafting bone, either from a donor or from animals. You would take the bone, graft it in the area, and then grow the bone, then place the implant. So that basically means multiple procedures, multiple surgeries, a lot of time and healing, discomfort, obviously, and patients, had a very, very long journey for absolutely no reason. So what we did, again, based on the current research and the modern science, is we changed the tactic a little bit. So we looked for solid native bone instead of using grafted bone that unfortunately a lot of times later turns into mush and it's not even usable. We use patient's native bone, which is stronger usually, doesn't require additional surgeries, and gives us better and faster results.
Is it a long, involved process?
The Teeth Now procedure that we kind of created is very streamlined. You literally, in 24 hours, you take patients from either no teeth or decayed, non-restorable teeth to permanent teeth, 24 hours.
Is it something that lasts the entire life, your entire life?
It can. It depends on a lot of factors. Most, again, scientific research shows us longevity of dental implants anywhere from 15 to 25 and more years. But a lot of it depends on patients' general health, which can change throughout their lifetime, and also on the maintenance, on care and maintenance. So we do insist that patients come back for routine hygiene so we can check things and clean things.
Are you trying to tell me that people don't generally take care of their teeth?
Sometimes they do.
You know, flossing is a big thing. You're trying to keep your teeth. I think that this is fascinating in itself. I think the fact that it's less invasive, your procedure, is a big thing. Not just, you know, for myself. I mean, I hate to sound like, you know, oh my, you know, I don't want to have to go through this, but, you know, I had parents and grandparents that went through dentures, and many, many different kinds of dentures, and dentures that didn't seat right, and dentures that were constantly slipping, or whatever the case may be. So
we see it very common. It's a very common experience. Patients really hate their removable appliances. So I'm yet to see a patient who is happy with their denture. So that was another push in creating a process that would give people permanent teeth. So the teeth that they wouldn't have to remove every day to clean. Teeth that wouldn't hurt them when they chew, teeth that wouldn't fall out when they laugh. That's what we did.
So if you hate your removable, you know, appliance, you'd want to give Dr. Kaplansky a call. Dentistry by Dr. Kaplansky, 8038 Rochester Road in Gasport. Phone number 716-772-7500. drkaplansky.com is the website, drkaplansky.com.
Sponsorship and promotional consideration for the preceding segment was provided by the following. Thanks for watching this edition of The Big Wack Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigwack.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to The Big Wack, Buffalo's oldie station.
The Big Wack Presents Buffalo on the Rise was sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.